Awesome. Well, I think we can get started, Carrie Ann. So just wanted to say welcome, everybody. This is our virtual discussion on common running injuries. I am Dr. Natalie Tilton, and I'm a physical therapist and the owner of a company called Ability Allies, and we are in Epping, New Hampshire. And yeah, let's get started.
One quick question, sorry, Natalie. Did you want to record?
Yes, yep. So, this is going to be a recorded session, and I'll do a playback for everybody, whoever would like to either see it repeated, or for people who've missed this as well, will be able to see it probably on either one of my social medias or my website or whatnot.
Amazing. Thank you.
Perfect. Of course. So welcome everybody, and I wanted to just say thank you especially to Carrie Ann and Mercuria Running, and we are all here today to learn about what's happening with our running, what's happening with any kind of injuries with our running, and how to fix them, of course. Our topics are going to be including hip pain, knee pain, which specifically going towards Patellafemoral Syndrome and iliotibial band syndrome. And we'll cover the foot and ankle, specifically Achilles tendinitis and plantar fasciitis. So I'd love to know who I'm talking to, and so please introduce yourself in the chat. You can say your name or quick hello. Maybe where you're from would be kind of fun, because I see that we have some people across the country. And I would love to know what your running goals are for the next year. So specifically what you're working towards, and if you want any specific questions throughout the presentation, if we're talking about the knee, then go ahead and throw it in the chat what your question is. If we have time, I can certainly read the chat as we're going, but we'll certainly save specific time for questions at the end. So if you're not muted yet, please mute yourself so that everyone can hear the presentation. And then at the end, like we said, we'll have time for questions, and at that point you can either raise your hand and we can call upon you, or I'll have Carrie Ann call upon you for the questions at the end there. So let's start with the hip pain here. So with hip pain, this can be either when you're running or either after runs as well. We're going to talk about alignment issues. So with the hip, you can have the SI, the actual hip joint, so internally where arthritic conditions might lay, or your lumbar spine actually might be influencing your hip pain as well. Lumbar spine position, specifically L5, is right in conjunction with your sacrum. But also generalized having a scoliotic curvature can influence all of that. Basically what it comes down to is that all of the pressure when you're running is going into the hip joint and hip socket and affecting you in different ways. So who might have this? How do you know if you have it? One leg is higher than the other. So oftentimes patients will come in and say, you know what, it feels like I'm on a curb, or, you know, when I do my runs, it feels like when I'm running on a slant, it actually is comfortable because it feels like my right leg is shorter than my other side. So those types of people might have this kind of alignment issue. Carrie Ann. Go ahead back there. There we go. So another thing that might happen is that your stride length is uneven. So it feels like one leg is kind of reaching out a little bit further than the other side. The last thing is that your knees, when you're standing, might tend to gravitate either towards or away from each other. This is known as a genu valgus or a genu varus type of posture. Basically, either you might see that your thighs are rubbing together when you're running, or that you feel like you're running on the outsides of your ankles. So how do we fix this? The first part is discussing about trying to do some detective work on where is the root cause of the problem. So there's a lot of things that can influence your alignment issues, like what we talked about, the SI, the lumbar spine, the actual hip joint. trying to find out where the root cause of that is. Could be from, where did this essentially start? So maybe 6 months ago you noticed a little bit of pain in that right SI issue, but now you're having pain in the front of the hip. Go back to that SI issue, and you might find that that's the root cause of the problem, that's the stemming of the problem. So trying to do that detective work to see where it started. Try to think about that. Keeping the hip joint to its full mobility. So if anyone has ever heard of the 90-90 stretches, so that's where you're sitting on a relatively flat surface, your knee is out in front of you, and then it's bent at a 90-degree angle. Your other leg is also bent at a 90-degree angle on the other side, and you're doing a series of stretches and putting your trunk forward to try to stretch out the socket of the hip joint. Cars is another one. If you're familiar with that, so that is when you're standing and trying to do mobility work where you're lifting your leg up and out and in front of you, or rotating it all back. So basically trying to get to the full extremities of the actual joint in the mobility. The last thing is working on single leg balance exercises. But the main part of it is to try to look in a mirror and keeping your hips and pelvis completely level to make sure that there's no any kind of dip going on there. Okay. So the next component is hamstring issues. So hamstring strains are the very most common injury in any sport, and they have the highest reoccurrence of injury rate. So who might have this? If you have pain in the back of the leg, and this could be coming from the very top where basically your glutes end, or towards the back of the knee where the other distal part of the attachment is. Long distance runners, especially who have fatigue or they're at their fatiguing point, can very much have a risk of a hamstring strain or pull or whatnot. Poor strength in hip extension. So either your body does not have the adequate glute strength to propel yourself forward, and therefore it's relying on the hamstrings to have too much of the brunt there. Or too tight in the hip flexors. So your iliopsoas muscle, the muscle that's right in the front of your hip, could be relatively too tight, and again causing that imbalance of either the gait or relying on the hamstrings too much. How do we fix it? So training with an adequate warm-up. So making sure that your body is nice and warm before you go out on a long run. Making sure that you're stretching your hamstrings and making sure that they're nice and warm and flexible before you're going out there. Prevent unsuitable fatigue in especially a long event. So ways that we can of course address this is making sure your food intake is having a high quality, you're hydrated well, your clothing is appropriate, and making sure that you are having a good sense of your energy taxation. So what I mean by that is that, if you are already at your absolute max fatigue, not a good idea to take a look at that runner in front of you and try to sprint to get in front of them. So just managing your energy and managing it well. In terms of running techniques, avoiding landing with the foot out way too far out in front of you. So that's when your knee is stretched out way too far and your heel is hitting the ground. Sometimes runners might get the sense of kind of like a jamming sensation where their foot is out too far and they're just overstretching them. But this takes risk of having a hamstring injury. And then strengthening the hamstring in a variety of methods. So there's a property of strengthening called eccentric strengthening. And what it is basically a slow lower or lengthening of this muscle. So by doing an eccentric strengthening of the hamstring, one exercise that I give my patients is to, sometimes it's walking backwards on a treadmill. Sometimes it is laying on your back and attaching a cord or a TheraBand to your heel, and you're actually pulling the band down in front of you. So instead of raising your leg up, the band is holding you and you're pulling it down. So think to yourself what exactly the mechanism of the hamstring does, and in terms of extending the leg, and how you can slowly resist those types of extension movements. Another thing on a side note of hamstrings is in terms of returning to sport. So if anyone has any people or you play yourself different sports like football or soccer, any kind of fast starting and stopping sports, it's really important, what I find most successful to completely minimize the risk of reoccurrence is doing return to sport activities. So in physical therapy, you can of course do all of the therapeutic exercises, but it's really great to do activity-based exercises. So a patient who is a soccer player, I have a soccer ball and I'm kicking the ball back and forth with them, and they're sprinting back and forth to me doing start, stop, and deceleration exercises, so that we know for sure that they're going to be safe going back out into practice and then into games there. So huge prevalence on strengthening those glutes, because those are what's going to help you and be able to propel you forward without having strain to the hamstring there. Now let's talk about the knee. So with knee pain, talking about Patellafemoral Syndrome. So a lot of people, young runners, females, I see a lot of females with Patellafemoral Syndrome, and it is the leading cause of pain in runners, and it is because of excessive stress to the patellofemoral joint. That is basically your kneecap and your knee. Who might have this? The pain occurs in the front and around the kneecap. It'll be worse with traveling, mostly on stairs, although you don't absolutely have to have that symptom in order to have the Patellafemoral Syndrome diagnosis. It is normally or typically worse with squatting activities or having symptoms with impact, of course, like running or jumping. So how do we fix this? Finding where the stress is coming from. So a lot of times when I have a patient that comes in with this diagnosis, it could be a variety of different things, and we'll list this out right now. So the quad or the IT band, having a lot of tightness. This is the first thing that I always will look at in a patient that comes in with this, is how tight are their quads, and is that quad actually kind of causing that strain on the patella and causing it to have a lot of pressure against the groove that it is supposed to be gliding in smoothly. So how do we fix this? Of course, foam rolling on the quad and the IT band. If you've ever done this, this can be, of course, a little painful. You don't want it to be incredibly painful, but just enough that you're tenderizing the tissue, stretching these areas, and of course doing other types of massage to it. See if that helps. If that does, a lot of times people will find an immediate gratification with that. And so if that helps, just keep going on that track of trying to loosen up the quads and the IT band, and that could very well do the trick. Another thing that I look at is weakness. So that slow lowering down from a shortened step. So again, that eccentric load. So having the quads have the ability to have a deceleration or a slow, gradual movement, but be strong in that slow, gradual movement. A person is completely capable of doing a great squat, lots of weight on it, having the bar, having 45-pound plates on each bar. But then I ask them to just go stand on top of a box and have them do maybe like a pistol squat, and they might say, "Wow, this is what's getting me getting the pain." So in those cases, we know that the weakness that you might have in your leg that just is a little bit altered can be fixed by just working on that eccentric strength of yours. Another thing that someone could have problems with is the patella tracking issues. So there's a groove underneath your kneecap that your kneecap is supposed to slide and glide through well when the knee flexes and extends, when it bends and it straightens. Sometimes, based upon a lot of different things, either maybe tightnesses of the quad or weaknesses of the leg, that kneecap is either getting pulled in one direction or influenced to just kind of glide outwards. In this case, taping or a very light knee brace could be helpful just to try to stabilize that patella, especially in longer runs. In that case, you would have to define what is causing the patella to have the tracking issues and then solve that root cause of the problem after the taping or the light brace there. Studies have showed also that patellafemoral joint stress with altered running techniques, it can change with altered running techniques. So a slightly forward trunk and using a minimalist shoe and a slight increase of cadence could possibly decrease the patellafemoral joint strain or stress. So definitely, rely on your running coaches to take a look at your form and technique and see if something of those changes can decrease your knee pain. Sometimes it's just all about form and technique that can make a big difference there. And that study also was by Tang and Powers from Med Science Sports in the exercise of 2014. So it's a relatively newer study and really great. So iliotibial band syndrome, with this is the leading cause of pain and discomfort in runnings on the lateral part of the knee, so the outside part of the knee. Most of the time when people come to me with this type of pain, it's right at the joint line of the knee, so people can get this a little confused with meniscus problems as well. Typically with the differentiator between a meniscus problem and with IT band syndrome is that with meniscus you might find that there's buckling happening. So if you've ever experienced where maybe you're going down a step or you're just simply walking and all of a sudden it feels like someone just took out one of your legs and your knee just kind of buckles or gives out from under you, it could be something going on with more internal mechanisms of the knee. But if you find that you've got pain just right on the outside of your knee, it can even feel like it's in your kneecap as well. This could be iliotibial band syndrome. So, of course, pain on the outside of the knee. The knock-kneed posture, so that's that genu valgum posture where you see the alignment of the knees are just kind of gravitating together. That type of posture has a really, really big pull on the IT band and therefore causing irritation and a lot of tightness to that IT band that obviously can be with this syndrome here. Another thing to see if you're trying to investigate if this is your problem or not is the hips can dip or the pelvis can be unlevel in a single leg stance phase. So you might see this in when you're running, if you've ever had a gait analysis where you feel like your pelvis has this really big dip happening, especially when one leg is hitting the ground. You can also do this test without necessarily running. If you're standing on one leg and you just notice that when you stand on one leg you might be fine, but if you stand on another leg, your hip definitely gravitates downwards and it's a little difficult for you to level it out. this is another thing that could possibly be from the iliotibial band syndrome. And then the last thing is having flat feet. So flat feet can cause, again, the knees to gravitate inwards and the hips having that really a lot of pressure on that IT band there. How do we fix it? Strengthening the hip abductors. So that's the muscles on the outside of your legs. Think like Jane Fonda when you're, doing the leg exercises, going up and down. If you're laying on your side, those are the muscles that you're working when you're doing that. The external rotators of the hip. Those exercises might include clams when you're lying on your side and your knees are bent and you're lifting up just your knee, keeping your ankles together. You can add resistance like a TheraBand with this as well. And then your core. So your core is going to really help keep the pelvis level, especially during that time where you might be evaluating the single leg stance. The core is going to help the pelvis. The external rotators are going to help the hip and the knee posture. And the hip abductors are going to help take less pressure off of the IT band there. If you have flat feet and you say to yourself, I was born with flat feet, I have always had them, there is nothing I can do to correct what I was born with, you might want to consider orthotics. So orthotics are just going to help give your foot that little bit of support so that they're not so flat anymore. And that just might be something to consider. I work with a product called Sole, S-O-L-E, and I make custom orthotics. So I will really caution a lot of people, it's not the first thing that I throw out to them. I don't want people to rely on orthotics, but it's one of those things that if you've gone through the rigmarole and you've tried a lot of different things, and we've discovered together that the root cause could very well be the flat feet, then orthotics might be a consideration for you. Doing dynamic balance exercises on the one foot. So that would be like standing on one foot, and what I do is I'll put either cones or different objects in front of them, in the front, a little bit to the side, and a little bit to the side. And I'll say, okay, you have to stand on one foot and you have to touch the cone in front of you. You have to touch the cone over to one side and you have to touch the other cone. So they have to bend all the way down and then they have to stand all the way up. And this works a lot of different stabilization and postural muscles, the intrinsic muscles of the foot and ankle that are working just to balance yourself, the pelvis to keep it level, and then the knee to keep nice and straight. So making sure you're getting all of that feedback to make sure your kinetic chain is starting to get solid. Having neuromuscular control of the glutes and the core. What I mean by that and how I test that is I'll take a patient and I'll have them, do a bridge. So bridge, you work on you can strengthen your hamstrings and your glutes with that. And they'll lift it up, they'll say, oh, no problem, I'm really strong here. But I'll flip them over on their stomach and I'll say, okay, can you lift up your leg with your thigh off of the table, but avoid arching your back by any means. And a lot of them have trouble doing this, and it's because of that lack of neuromuscular control of the glutes. So it's basically having a complete isolation of one muscle group that you're trying to engage and enhance. With the core, it's not about doing abdominal exercises or sit-ups or even planks. What I'll do is I'll lie a patient on their back, I'll have them bend their knees, and I'll say, can you just suck your stomach in? Can you suck that belly button in towards your stomach and see if that's the only muscle that you can react and engage? And a lot of times people will have difficulty. They'll tilt the pelvis, they'll clench the glutes, or they'll use other muscles to do what the core is supposed to do. So trying to have that isolation and that neuromuscular connectivity of your mind and your body is good for these natured things. And then on the gait analysis, when I do with my patients, I do a video gait analysis, and what I'll show them with these kind of things is especially the pelvis remaining level, and doing an evaluation of well, how are you running with your shoes, without your shoes, and then do a before and after. So when they were having the symptoms, what did their running form look like, and what sort of postures were influencing all of the strain and stress to go on the IT band. And then once we do these exercises, strengthening the abductors, the external rotators, the core, doing the dynamic exercises, after a certain amount of time when their symptoms have resolved, we'll do an analysis again to see that everything is leveled out, that their knee is nice and straight and not bowing inwards, and that they have good foot control and posture there. So now we'll move on to the ankle here. So in terms of the ankle, we're going to talk about Achilles tendinitis. So Achilles tendinitis is inflammation and irritation at the heel area or lower than the calf. Who might have this? People who frequently run up inclines. And that just might be a nature of the area that you run in. It might be that you do a lot of hill training or hill running or whatnot. Sometimes I've had patients that come in and they've been doing like stadium stair running just to try to get their calisthenics up and their plyometrics up and whatnot. If you are thinking that you might have Achilles tendinitis, you very well possibly have difficulty with something called a dorsiflexion movement of the feet. So basically it's the foot and the ankle, and you're trying to come upwards. So if this was the heel and this was the plantar part of the foot and these were the toes, so doing this while either standing or sitting. So difficulty trying to heel walk basically. Another component is pain with raising up on the toes. So in the dorsiflexion motion, you're stretching the Achilles. In raising up on the toes, you're contracting the muscle. So one might cause pain because of the stretch of the tendon, and one might cause pain because of the activation of the tendon. So in terms of correcting this or trying to resolve this, massage to the calf muscle and a progression of stretching the calf muscle. A lot of times my runners will come to me and say, I had Achilles tendinitis, I know that's what it was, and I really stretched, and that actually made it worse. So you want to be just careful of overstretching it in both the capacity of the length of time you're stretching it and the intensity that you're stretching. So if you fit all of the categories of who might have this, so if you did a bunch of hills last week and now your Achilles is killing you, it's hard for you to lift up your foot and toes. It's very painful for you to raise up on your toes. If you've kind of checked all those boxes, probably not the best to go into on a step and try to do that stretch where you're lowering the heel down. That's a little too intense for something like that. Best to try to do a gentle stretch on just a flat surface, so just a regular calf stretch, but lessen it to about 50% of your normal intensity with that. Doing a very slow progression of building that eccentric strength. So the ability to slowly lower the heel down from an elevated position. My favorite exercise for people who have Achilles tendinitis, but they're not in an acute phase. So it's the phase where, you know, you've iced, you've remedied it, you've massaged it, and you can do some stretches. So now we want to try to build that strength again so that you can run up those hills or do your long runs without having that heel pain. The slow progression of the eccentric strength, it has to do with, my favorite exercise is when somebody will raise up on both of their toes. So you're both up on your toes, and then you're going to lean over to the side that you have the injury on, and then you're going to slowly lower down just on that one heel. So that really does a great job of building an eccentric strength to that one side. You can then progress upon that by just doing that single-footed instead of both feet starting there. And then plantar fasciitis. Plantar fasciitis is the inflammation and irritation at the bottom of the foot, so the plantar aspect of the foot. There are muscles under there, the plantaris muscle that's in charge of basically stabilizing the foot. People who have this will have a lot of pain with standing, and the most common thing that patients will describe is especially when their feet first hit the ground in the morning. So after obviously them being non-weight bearing for the length of time that you're sleeping at night, feet first hit in the morning, they're stiff, they're rigid, they're painful, they're kind of hobbling to the bathroom or going to get their coffee or whatnot. You could very well have more symptoms with less supportive shoes, or you're walking around barefoot. Oftentimes people who enjoy walking barefoot and then do something a little bit extra or excessive, either in barefoot or very minimalist shoes, can spike up a lot of irritation at the bottom of the foot there. So with plantar fasciitis, you can have this injury or ailment if you have very, very flat feet or very high arches, so supinated feet, but have tendencies to overpronate. Overpronation means that when your foot is hitting the ground, your ankle kind of tilts inwards a little bit. And so that's not good when it's doing it, or when it's having an overreaction to that type of mechanism. In terms of trying to help this injury, stretching the ankle into that dorsiflexion motion, so having the ankle, the foot come up like that, and then also adding the big toe. So the big toe has a fantastic tendon to it that elongates all the way down to the heel. It's very innervated into the plantar area. A lot of fascia is in that area too, so having that adequate stretch can significantly help reduce some tension to that area. Toe yoga, if anyone has ever heard of that or done that, you can YouTube it. They're kind of fun to try. It's kind of like if all of your feet are on the ground and you're sitting or standing, if you're advanced, and they'll say, okay, lift up your big toe, only your big toe, and then put that down, and then lift up all of your other toes, but keep the big toe down, and then splay them out, or try to scrunch them in. Toe yoga is a fun way to strengthen what's called the intrinsics of the foot, and those are all those postural stabilization muscles that help support the foot and keep the arch of the foot well, instead of it tending to be flat or flatten out as you're running or walking. Orthotics, again, I'm not one to completely push orthotics on somebody, but when they have the need, they're gonna need them. So again, if you've been born with flat feet, you have consistent ankle sprains, or plantar fasciitis has been a recurring ailment for you, you might want to consider orthotics to just give yourself some support. Even perhaps during your running season, getting yourself a little bit more supportive running shoes as well, if you find that this has been a reoccurring problem there. So I just wanted to give a little example of something that I do in my clinic in terms of a video gait analysis. And so this was a young boy who his mom came to me and said, my son runs funny. That was just it. It was like, he kind of sometimes can trip over himself, or he has this funny thing with his run. So if you press play there, you can see there's a couple of things going on where, number one, let's start from the top and then work our way down to the bottom. So he has a little bit of a rigid trunk. There's not too much motion going on, so that's involvement of the lumbar spine. His arm swing is very, very low. So again, with the trunk, sorry, Carrie Ann, thank you. So there's not really a whole lot in terms of that, the upper body helping his lower body have that propulsion forward. His hips don't have too much of a dip to them, but you can kind of see how they have a big shift going back and forth. So his body will really heavily rely, instead of having a dip, it literally shifts all the way over to the side. And that's called a list. That's called a trunk list. I can see it. It's a little difficult for some people to see, but not only does he have the list, but at that point upon the list, that's when his hip has the dip to it, has the unleveling. When we go down to the knees, both of his knees are internally rotated, so that actually comes from the hip. There also is that little bit of that genu valgum posture, so you can see that they're not exactly completely straight. They do have that bowing in tendency. Additionally, at his feet, turning inwards there, and you can see there's a couple of moments that he actually almost has to correct himself in terms of the gait because his foot is about to hit the other one. And his body has to naturally try to attempt to separate that. So with a patient like this, they normally will come to me either because they have some sort of an ailment or an injury. They have a pain, but they don't know where it's coming from. And additional to that, this mother and son team were just noticing that the walking or the running pattern was definitely not very symmetrical. So what we did with him was, of course, core strengthening to help with that pelvic list, external rotation strengthening to help with both the knees going inwards, the valgus posture, and the internal rotation of the hips. And then we did a lot of heel walking with him. The last thing on his analysis was that his feet had a tendency to kind of have a pretty big slap on the treadmill there. So sometimes people can have just not quite enough flexibility in either their calf muscle, the Achilles, or even hamstring for that matter, and they don't have that flexibility to have a good quality heel strike on the ground. So like I said, a lot of people will come to me for like the video gait analysis just to say, I know something's going on, but I don't know what exactly, like why I'm having this pain during my run. So that's why these can be helpful to observe in somebody and take note of their form, but also give them reasons as to why they might be having the difficulty or repetitive strain on their body because of these alterations in their running form there. Alrighty, so we'll open the floor for any questions. Feel free to raise your hand if you're visible in here, or you can certainly write anything in the chat too if you'd like any questions answered. And Carrie Ann, if you wanna call on anybody.
I can kick it off with some questions that were given. Or Steve, I see you unmuted. Maybe you want to ask one.
Can you hear me?
Yeah.
I don't know if it's really a question. I'm actually feeling pretty decent right now, but a few months ago I did the Providence Half Marathon. About like mile 7, I started getting some serious knee pain in my left knee, and I thought, oh my God, this is going to be a DNF. I'm not going to finish this. And then I ran through it. By mile 10, I was feeling really good. I probably had my best mile at the end of the race, but then the knee pain came back with a vengeance. And I've noticed in other long runs, after 6, 7, 8 miles, it's it's always that left knee that starts to hurt, and so that I'm almost limping. So that's probably been my biggest concern, and so it sounds like it may be one of those patellofemoral or maybe IT band syndromes that you're talking about. So I'm just trying to be really conscious of gait, and I do a lot of yoga and strength training to try to strengthen my backside and try to avoid that pain. That's my biggest issue right now, and it's my biggest concern and fear when I'm running.
Sure. Is the pain localized in any particular place at the knee?
It seems to be like more medial.
Yeah.
Like on the inside, some just around the knee.
Sure.
I don't know if it's the patella itself, but I mean it was pretty significant. I mean, somehow I finished that race, and like I said, I was shocked and pleased and amazed when it just kind of disappeared by mile 10.
Sure. Was it a particular
thing?
Yeah, was it a particular like hilly race, or did it have ups and downs to it?
Yeah, it was actually pretty hilly. It was in Providence.
Yeah.
It was fairly hilly.
That first makes me
really make me nervous.
Of course. So my first inclination with you would be to evaluate the tightness of your quad. So you might be one of those candidates that first part of the how to fix it. So quad might be super tight. I think that because you had it at mile 7 versus like mile 2, so your quads are really working. It's going up hills and all of that. So it's really kind of over taxing on your quads. So I would first try some foam rolling on the quad there, and you can angle it too. It's called the quad because there's 4 muscles in the front of your leg there. So it's helpful also to tilt your body a little bit, so you're getting a little bit of the medial part of your quad, the center, and then a little bit of the outside as well. And then of course stretch right after that, and see if you can touch your heel to your back side when you're laying down. So if you're laying down on your stomach, can your legs be straight, and can you touch your heel to your back side? Does that feel tight? If so, then definitely something to keep working on.
If I assist myself, I go to yoga every week, at least once a week. So
sure.
That's like in the bow pose, you touch your feet to your butt and you stretch up. So yeah, no problem doing that.
Sure.
I mean, I can't just lay there and touch it. I gotta use my feet. I gotta use my hands to push my feet back. But
sure, yeah. Another thing too that I'll advise patients on is if you're standing, and can you touch your knees completely together and keep them together, and then can you touch your heel to your back side? Can you reach back and do that? It's kind of a stretch too. If you're obviously well versed in yoga, if you get to that phase, and then the next part would be, can you then bring the quad that you're stretching, the leg that you're stretching, can you bring that knee past the other knee? So trying to go like into that boat pose, but with the heel still touching your butt, basically your back side there, and see if that can do the trick. So I would try a little bit of trying to address quad tightness and see if that helps with your medial knee pain there.
Yeah. One other question.
Yeah.
I'm frozen, but you can hear me okay?
Yeah.
Okay. Is wearing I used to wear a brace, but I stopped wearing a brace in the past couple of years. I didn't feel like it was helping, and I noticed that in one of your PowerPoints, you sounded like a light brace, and is that just kind of covering up the symptom, and I should really get to the root cause of the problem and avoid? I've not been wearing a brace for the past couple of years, and I don't think I've missed it, to be honest.
Yeah, that's a great question, and that also goes with ease per se. So in patients that are actually actively having painful symptoms in their knee and they have a lot of difficulty running, let's say that, like I had someone last year training for the Chicago Marathon, and she started having knee pain, and it really wasn't resolving because she was on she was increasing her mileage on her runs. So she had a couple choices. She had somebody say to her, well, you should just stop running. She had, other people say, try this, try that kind of thing. And when we were working together my resolutions for especially elite athletes that are wanting to resolve their pain but also not miss a beat in their training for whatever goals they're wishing was a knee brace can be a nice temporary solution to help assist the alignment of the kneecap and get over a hump, basically. So get over the acute phase of having the inflammation that might be taxed underneath the kneecap. And I say light brace, but meaning it's not one of those big, bulky metal supported braces. It's something like a sleeve that you roll
like
up.
A sleeve you pull over.
Yeah. So I wouldn't want somebody using that for any more time than what they need, only in a very short phase. So if you came to me and you said, I'm having this knee pain, but I have Chicago Marathon in 3 weeks, I might have you wear that brace just for your long runs, but if you can accomplish any kind of short distances without the brace, then do not wear the brace. In the meantime, when I'm working with a patient like that, I'm doing everything I can to try to minimize their symptoms and have strategies of their training so that they can continue training and they'll be able to complete the marathon in a safe way, but also without having to, suffer in any kind of pain or risk leaving the race because of their unresolved knee pain. Does that make sense?
Total sense.
Awesome. Good. Great. Anybody else?
Hey,
yeah.
I've got a whole list of...
Hey, yeah, of course.
So I've also got a little bit of... actually, I felt really great today. I had a great hill run, and so I'm feeling pretty good. But in the past, I've even gone to PT for it. I've had some tightness or some pain in my... It's not in the right hip area, like in the back, like just above the hip. It's not the joint. I don't know if it's muscular, but sometimes I'm out running, I say, gosh, this just really hurts, and or just sore. It's tight.
Sure. So it's kind of like your.
Right,
what's that?
Doing pretty well right now. It's a little sore, but not bad.
Sure. So oftentimes, right above what we call the iliac crest, so it's a part of your pelvis skeletal structure. The components that are right above that are your lats attachment and your quadratus lumborum. So your QL is a muscle that is a stabilizer muscle. So part of that, when we talked about the pelvis having that little dip to it, I would take a look at that in yourself and see if you're which side did you say it was on?
That's on the right side.
So that would mean that if you are standing on your left leg or taking impact on your left leg, are you able to keep your pelvis level, basically? Or are you noticing that you feel a little bit weaker on your standing on your left leg comparative to your right? It could be as easy as just having a little bit of tightness at your QL that you could stretch, or doing a little bit of trigger point massage to it to see if it just is giving you a little bit of grief there.
I do know, like if I'm doing like in a yoga, when you put your legs, stretch them out as pretty far, and then you put your arms out and then bend down at the waist to put your head to the ground. I do know that my hips are uneven. And that's
Sure.
Really about.
Absolutely, yeah. So that certainly could be a component. And if you remember on the young boy who was very rigid in the trunk with the video gait analysis, on someone who might come into me and say, I'm having some pain where you're stating, if they're a runner, and this is part of our goal is to get them fluid and pain-free running, when I look at their gait analysis, what could be a tendency is that their trunk swing could be adequate, but it could be much more restricted on one side. So if I over accentuate, it might kind of look like this, like their arm might have a really big swing in front of them, but the other arm is limited there. that tells me that something is going on at the trunk, whether it's a trigger point knot, whether it's just a muscle tightness. And again, those kind of things are really great to just try to do some detective work, because they are easy fixes.
Okay, thanks.
Absolutely, yeah, happy to help.
Natalie, there is a question in the chat.
Sure.
From Justine. Justine, do you want to talk about it, or you want me to say it?
I can do it. Hi. Thanks, Natalie.
Hello.
Hello. So I have a lot of piriformis pain, and this is new this year. I always have some pain somewhere every year, and this year it's that. And I just wondered if you could talk a little bit about is that an overuse injury? Are there things in my gait or strength that I might want to build up that could help that?
Absolutely. So piriformis or pain in the piriformis area could be because of a lot of different things. The first thing I would look at, just because it's the easiest thing to resolve, is just to see if the piriformis is just having a muscle knot in it. So sometimes the way that you run, so it could be a very well running form problem or issue, that just a lot of the strain and stress is going on to your piriformis muscle, and it is overloaded. When it's overloaded, it tends to tighten up, because it's not really a very big accelerator muscle, if you will. It does have a little bit of activity to it, but that also could be a muscular imbalance issue, where your piriformis is trying to do the work of what your glute max is supposed to do. So the second thing I would ask for you to try to look at is that neuroconnection response of what we said. So can you actually lie on your stomach, and without using any other muscles in your entire body, can you lift up your involved leg only using your glute muscle? Or are you noticing that your body is recruiting all of these other muscles to try to lift that leg? If that's the case, for sure, it's just a matter of your body just is using the wrong muscles in terms of the wrong time, or trying to do some over recruitment, and the poor piriformis muscle is taking too much of the brunt there. Stretching the piriformis can also be really helpful, especially before your long runs. Do you have a particular way that you like to stretch it, or that you've been looking to stretch or whatnot?
So I've been foam rolling pretty constantly, and stretching sort of like when you put your foot over your knee and you bend back, so it stretches all the back of your butt and your hamstrings. So I've been doing a lot of that, but I haven't been doing it necessarily before I run. I've been doing it after I run.
Sure, yeah. Before you run, for sure, do that stretch. You can even do it standing as well. So if you do that crossover with your leg, squat down a little bit to start feeling the stretch at the piriformis, and then also bow your trunk forward too. Those are different components that you can do to get a really good stretch of the piriformis. And then when it comes to tenderizing it or trying to do some self-massage, my favorite piece of equipment for the piriformis specifically is a lacrosse ball. So it's nice and small, it's round, it's firm enough that it can get into the glute tissue. The piriformis is a couple layers down too, so you have to go through a lot in order to actually get to it. A foam roller is definitely a fine thing to do, but the lacrosse ball or something like a tennis ball is definitely my number one choice.
Great, thank you so much.
Absolutely, yeah, happy to help. Alrighty, we have a few more minutes here. Does anyone else want to have any questions answered?
It looks like Aubrey.
Hi.
Hello.
So the first time we got together as a group, and we ran around a track, and it was like 3 miles, something like that, maybe 2 miles, and I had COVID, but before that, I was running, I was hiking, I was working out, and I injured my right hip, and it's kind of like on this part of the hip.
Sure, yeah.
And so obviously I continue to roll and run and stretch. It's still there, but I'm still able to run the long runs, but I still just feel the hip pain.
Sure.
But it's not as bad as in the beginning, and I definitely felt like I almost had to walk like on my toes on my right side.
Okay.
I feel like it was uneven.
Yeah. Yeah, for sure. Absolutely. I think that would be my first go-to is what's happening at the pelvis that could be causing all like that issue for sure. The area that you pointed to, it's right smack dab on the outside. It's not like it's in front. It's not like it's in back. So that's your TFL. So that's your tensor fascia lata. So it's the little muscular component that is right above your iliotibial band, so your IT band. That's the muscle that is associated with it. So if you look back at our notes and see the iliotibial band and how to fix it, that's definitely something that I would recommend for you to give a try. My first instinct as well with you would be more of the strengthening. So strengthening the hip abductors, the laying on your side and trying to lift your leg up. I would be really interested to see if you try that exercise, see what happens at your ankle. Because oftentimes with runners who describe your type of injury or condition, their ankle will tend to gravitate like one way or another. So I'll witness them that they're trying to lift their leg up purely sideways, but their toes are kind of tilted downwards or upwards. And again, that has to do with the combinative leg weakness, meaning you're a little bit weak at your adductors, a little bit weak at your external rotators, a little bit weak at your extensors. So it's really difficult for your body just to say, okay, I just have like one injury and here it is. But with that type of thing, it's a little bit more tricky because it's not one big injury or ailment per se. It's a lot of little things that are connected to cause pain in that area there. So that would be my first piece of advice is try to do some strengthening, lift up that leg sideways, doing some clam, do you know what clams are? Yep, perfect. So doing the clams, and rolling at that IT band to try to loosen that up. And then as far as running form, try to keep that pelvis level there. And then one other thing that I will say too is sometimes alignment issues can also be a factor. So sometimes you might find that if you're doing all of those resolution techniques and you still find that there's that little tweak right there, that would make me think that there's an alignment issue with the actual SI joint or pelvis there. And in that case, you got to come see me. I'm sorry, that's what you got to do.
That's okay.
I can't.
I probably will call to set up
I'd reach through the computer and pull on your leg and twist this and put a towel under this, and then I would say, okay, you're good.
I'll call you tomorrow.
Sure. Yeah.
Thank you so much.
Oh, of course. Absolutely. Great. Any other questions? I'm happy to answer anybody else if you need to, but thank you again so much to Carrie Ann. Here's all my contact information. So my company is Ability Allies, and again, we're located in Epping, New Hampshire. It's right off of Route 125. And my phone number is there. My business line is connected to my cell phone. So if you'd like to send even just a quick text message, you're welcome to do that to this business line. Even if you have a quick question, I'm always happy to help athletes in the area. That's my jam. My specialty is the athletes, sports and orthopedic natured. I always love helping people resolve their issues, get back to where their athletic goals are, and go for gold there. My email is hello@abilityallies.com. My website is www.abilityallies.com. You can take a look at it. I didn't want to talk a lot about me, but I am an athlete myself. I was pretty good at field hockey. I won't go too into it, but if you do want to do any more research on me, feel free to check out my website, and the About Me tells about my athletic history there, and then my passion for physical therapy and helping other athletes. And then social media, I'm very active on social media. I would love for you guys to follow me at Ability Allies. I'm on Instagram, I'm on Facebook, and I'm happy to be here and talk with all of you. So thank you
so much, Natalie. This is great.
Absolutely. And thank you. Thanks. I will be also this Saturday at the Long Run group. So I'll be there in person. I do a little pop-up event, and feel free to come on by, say hello. If anybody wants me to actually take a look at you and give you a really solid idea of what could possibly be happening, please come to see me on Saturday, and I'm happy to help you.
Yay!
Cool.
Awesome. Thank you so much.
Awesome. Well, thank
Thanks,
you.
everyone, for joining.
Awesome.
John, it's so nice to see you.
Nice to see you too, Carrie. Thanks so much, Natalie. That was great.
Oh, you're so welcome. Happy to help you.
I'll try to come Saturday. I don't know. I feel funny. I don't want to take up time. I'm kind of out of commission for just a little while here, so.
Sure. Yeah. Anytime. Reach out anytime. I'm always happy to help you.
Yeah, I think I'll probably email you tonight or tomorrow.
Of course. Absolutely.
Thank you.
Awesome.
Bye,
Thanks,
Angie.
Angela.
Thank you. Bye, Lisa.
Awesome.
See you Saturday, Joan.
Awesome. Thanks, Carrie Ann.
Thank you. This is great. Thanks, Natalie. I'll see you Saturday.
Oh, great. Yeah. See you Saturday.
Bye.
Bye-bye.